So many people are confused about thyroid health, and many of them are currently on thyroid medication and they don't feel any better. Often they wonder if something else more serious is going on. So I want to share 3 questions to ask before going on thyroid medication, or even if you're already taking thyroid medication. The conventional approach to treating hypothyroidism is to prescribe thyroid hormone replacement. Doctors typically test your TSH, or thyroid stimulating hormone, in your blood work, which is part of the routine test. But what many people don't know is that the standardized test doesn't cover your other thyroid hormones, like T3 and T4. This standard test also doesn't look at thyroid antibodies to see if you're having an autoimmune reaction in conjunction with poor thyroid function. What often happens for people who go on thyroid replacement is that there's a slight or short reduction of symptoms initially, but months later they find themselves right back where they started, dealing with the fatigue, the weight gain, the brain fog, and more. So there could be many issues going on behind the scenes that you aren't aware of and your doctor isn't investigating. Like gut infections and inflammation that can literally be inflaming your thyroid. Many people have bacterial overgrowth, yeast infections like Candida, or conditions like leaky gut or SIBO, small intestinal bacterial overgrowth, that can send your thyroid into a tailspin. Having gut issues can also cripple your ability to absorb or convert thyroid hormones that circulate in your blood. In fact, the cells and bacteria that are in the lining of your intestines are also responsible for T4 to T3 conversion, meaning the active form of thyroid hormone isn't getting into your cells. So even though the thyroid may be producing thyroid hormone, your cells aren't getting what they need. If your adrenal health is off, this could be the reason your TSH is off too. When your adrenals are overactive because of stress, they release higher levels of cortisol, which actually suppresses the production of TSH. So your thyroid gland isn't to blame, it could be your adrenals. I also see people who have been told in the past that they have their thyroid problems under control, only to find out that they're already having autoimmune-like reactions which cause their thyroid gland to become even more inflamed. Since conventionally trained doctors rarely test antibodies, because it's not part of the standard protocol, there are so many people out there taking medication that don't address all the issues impacting their thyroid and their overall health. In fact, some people find themselves with full-blown autoimmune conditions after many years of being on standard thyroid medication, not realizing that gut imbalances and lifestyle factors that cause autoimmune disease went untreated. So the 3 questions you need to ask yourself is, number 1, could it be gut issues that are causing your symptoms as well as impacting the conversion of T4 to T3? Could it be your adrenals and stress hormones impacting your thyroid? Or 3, could you be at risk for autoimmune thyroid and already having autoimmune reactions? Unfortunately, if you ask your doctor these questions, you might get blank stares. And it makes sense because most of this isn't covered in standard medical school training or part of the cookie cutter approach to treating basic thyroid issues with medication. This is why you'll want to work with a medical professional who has additional training in functional medicine like I do, so that you can get the standard testing plus more advanced thyroid hormone testing to discover which issue is really driving the bus. People don't realize that there are so many other contributors to low thyroid function. In fact, your thyroid doesn't operate in a vacuum, so if it's malfunctioning, you don't just treat your thyroid gland, you find out why. And that's why so many people who are still on medication are struggling with serious symptoms like fatigue and weight gain, sleep issues and brain fog, because the gut imbalances, adrenal issues, or other factors are clobbering their thyroid function. So many people are prescribed thyroid medication as a knee-jerk reaction, but the truth is you may not need medication at all. Or for those of you who do need medication, you might be on the wrong type, a synthetic versus our bioidentical. Or even worse, you might be on the wrong dose. What we have discovered from working with so many patients is that once you correct your gut imbalances and adrenal issues, this allows your thyroid to stabilize, We also see in testing that your TSH, T3, and T4 often normalize, meaning medication isn't necessary if you approach the problem at its root. In the rare cases where thyroid hormone replacement is necessary, we explore the right amount of a bioidentical replacement so that you can avoid all side effects. To go deeper on the topic of thyroid health, register for my free video series on rebalancing hormones naturally. Simply click the link next to this video.